Dementia can be a devastating diagnosis for a patient and for their family members. Not only does dementia limit their ability to conduct their activities of daily living, but it also impacts their family members in a similar way, limiting them in their ability to conduct their responsibilities while they care for their loved ones. This disease is especially impactful to people who have been accustomed to playing certain roles of responsibility in societies, who were standing on their own 2 feet up until that point that the diagnosis was made, and thereafter becoming dependent, losing their autonomy, and becoming a burden to their family members. The family members are affected psychologically and socially because their responsibilities to their loved ones are now impacting and impinging on their responsibilities to other members of their family and at the workplace and other such places. Bearing this in mind, it is obvious that finding a solution to this problem by preventing the onset of dementia, this largely incurable disease, would have a massive and colossal impact on the effect that dementia has on society as a whole. The economic and social and psychological damage that it causes to the patient and to the family member and members who are involved in the care of the patient. But what is dementia? Dementia is the loss of the ability to form new memories and to recall memories, usually recent memories. And the etiology of dementia is obviously multifactorial, but the most common form of dementia in Western societies is what we know as Alzheimer's disease, which is a form of dementia that is characterized by the destruction of the nerve cells in the brain, known as neurons, as well as the formation of neurofibrillary tangles and beta-amyloid plaques, characteristic findings in this disease. Although we don't have concrete knowledge as to what the etiology of dementia is, at least in the case of Alzheimer's disease, we do have a clear picture of the existence of risk factors that can predispose individuals to the development of dementia. Curiously, these risk factors are shared risk factors in that they are shared with cardiovascular disease, and risk factors such as high cholesterol, high blood pressure, diabetes, and lack of exercise are risk factors that we recognize as risk factors causing cardiovascular disease. At the same time, these are the self-same risk factors that can predispose individuals to the development of dementia. Dementia does not have one single cause. As far as we can see, dementia seems to be caused by a combination of factors, including environmental factors and genetic factors and lifestyle factors, so that a single intervention, such as exercise, as we're discussing here in this video, will not eliminate all of these etiological factors and miraculously dispel and dispose of dementia. Rather, to eliminate all risk of developing dementia, one would need to pay attention to all of these factors at once. Some of them, as you can see, for instance, the genetic factor is unalterable. Other factors, such as our lifestyles, are modifiable, and therefore we can attack and we can prevent the onset of dementia through the modification of these factors. The one that we are looking at here today is, of course, exercise and physical activity. But how does exercise affect dementia? How does exercise prevent dementia and lower the risk of dementia? Exercise causes the demand for oxygen and the demand for energy in the tissues to increase. The body physiologically responds by vasodilation, which is dilation of the vessels to the muscles and to the brain. This increases the circulation to the brain, which stimulates the production and the secretion of neurotropic factors in the brain, one of the most important of which is brain-derived neurotrophic factor, or BDNF, which is a neurotropin that has multiple effects on the tissues of the brain, including the stimulation of nerve growth and the increase of neuroplasticity, the ability of the nerves in the brain, connections in the nerve to adapt to increase and altered needs. And it also affects the growth of vessels in the brain and the number of branches that are formed between the various neurons in the brain. These contribute to the formation of new memories in the brain and therefore can help to prevent and, if not improve, the brain function in patients with dementia, such as Alzheimer's. Beyond BDNF, exercise also stimulates the secretion of insulin-like growth factor 1, which is also a neurotropic substance that can help to promote the growth of nerves in the brain. And it also stimulates the production of antioxidant molecules such as SOD, or superoxide dismutase, and glutathione, which are antioxidants that can prevent the oxidation of brain tissue. It decreases oxidative stress in the brain and protects the brain against oxidative damage. Exercise can also stimulate the secretion of anti-inflammatory cytokines, such as interleukin-4 and interleukin-10, which decrease the inflammatory response in the brain, thereby protecting the brain tissue. Now, we have numerous studies that have been conducted that support the theory that exercise is beneficial to decreasing the risk of dementia and improving the symptoms of patients who are already suffering from dementia. But beyond the experimental evidence, we also have everyday evidence, everyday situations that support this theory. One of the most striking of these is the fact that dementia is more frequently encountered in the developed world than in developing countries. And one of the possible explanations for this is the fact that the level of activity that people in developing countries partake of, physical activity, is generally higher than the level that is found in a developed country for obvious reasons. I mean, the convenience of having trains and cars and other means of transportation at their disposal decreases the daily activity level of people in developed countries, whereas in the underdeveloped world, this luxury does not exist. One of the most cardinal examples of the importance of movement and physical activity in the prevention of dementia is that demonstrated by the Tsunami people of Bolivia in this Bolivian Amazonian forest. These people were found to have a lower level of atherosclerosis and a lower level of dementia than people of the same age in the developed world. While their genetic makeup and their diets may contribute to this stark difference, one of the more likely explanations is their level of activity. These people are engaged in farming and hunter-gathering. They walk miles a day in search of food. Now, the obvious question is, how much exercise is enough? Studies have shown that moderate intensity exercise, up to 2.5, about 150 minutes per week, can prevent the onset of both dementia and cardiovascular illnesses. But how do you know if you're performing moderate intensity exercise as opposed to low intensity and vigorous exercise? A simple way is to conduct the talk test while you're doing your exercise. The talk test is a test for you to see whether you can speak while you're performing the exercise and whether you can sing while performing the exercise. If you can speak while you perform the exercise but you cannot sing, then that would be considered moderate intensity exercise. If you can sing while you perform the exercise, that means the exercise level is too low. And if you're unable to speak while you perform the exercise, that means the level of exercise that you are performing is too high. I hope you found the video useful. If you did, subscribe, share the video with your friends and family, and until the next video, stay healthy and stay safe.